By now, you're hopefully practicing your social distancing, washing your hands throughout the day, and only going out when necessary. We're continuing our discussion on the pandemic COVID-19 coronavirus. And if you've been keeping up with the news, you know the numbers are multiplying at an alarming rate. So what are we to do here in Central Florida? On this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Hello, I'm Clarence Reynolds and your host, and with me is Orange County Mayor Jerry Demings. Thank you, Mayor, for joining us today.
Glad to be here with you today, Clarence.
Let's start with a county overview. What's going on now with the pandemic in Orange County?
Well, we're now several weeks into the pandemic, and today here in Orange County, we will cross that threshold where we'll have over 600 positive cases within our community, and 5 people have died as a result of COVID-19 within our community. So we're seeing now the numbers are beginning to escalate fairly quickly within Orange County itself, and so we have a number of measures that we have put in place within the last couple of weeks to try to mitigate the spread of the virus here within our county.
Now, the governor recently enacted a statewide order. Can you comment on that order?
Yes, the governor essentially put into effect for all of Florida a safe-at-home order, which is similar to the stay-at-home order that we issued here within Orange County. The stay-at-home order that had been done at the county level terminated last night, and we have embraced the order that the governor has put in place. However, there still remains a nightly curfew in Orange County from 11 p.m. to 5 a.m. All of this is being done to create the social distancing, to keep people apart, to keep people from meeting in large groups, to abate the spread of the virus within our community.
Now, there are some essential businesses here in Orange County and throughout the state. Can you help us define what those are?
Essentially, businesses that have been deemed essential are those which support life, health, or safety-related sectors of our community. So if you're a grocery store, if you're a restaurant, if you're any type of business that supports that supply chain of food in our community, you have been deemed essential. If you are any type of business that supports the infrastructure, the government infrastructure, you're exempt. That would be our first responders, other government workers, healthcare workers, and even in support of these particular life, health, and safety are businesses like construction businesses and the like that support that. Obviously, any health-related businesses, and sometimes that is somewhat expansive as we have to move medical supplies around. Pharmacies are exempt. So those are just a sliver of the types of businesses that have been deemed essential. If businesses that have been deemed non-essential are businesses such as hair salons or nail shops and the like. Those are non-essential businesses, and essentially what the governor's order says is that those types of businesses are ordered to cease operations for at least through April the 30th, and more than likely at that point we'll have a body of knowledge or data by which to make additional decisions. But many of the modeling programs that I have looked at to evaluate how the virus is spreading throughout America, throughout Florida, indicates that we will have a surge or a peak in the number of positive cases in late April, early May.
Now, which county offices are open? Since we know what essential businesses are open, which county offices remain open?
Because we are a county government, we have kept the county services open for business. However, we have over 40% of our employees now here within county government who are telecommuting. They're at home working. We have ceased operations for non-essential county services such as advisory boards and the like are no longer meeting while we're under this heightened state of emergency. We have reduced the interaction between county workers and our residents. Much of what we're doing now is being done through online processes from construction permits that are being processed, and even submission of plans for land use matters. All of that is being done electronically now at this point. But there are other certain businesses of certain functions of the county that have had to remain open, such as support for the courts. Obviously, we run a fire department, a corrections department, the jail. All of those things have to remain operational in order to take care of the life, health, and safety needs of our community.
Now, what other services can people access if they need help, like financial services and things like that?
We have a crisis assistance program that is a standing program that we had as a portion of the county's budget. What we did was during this state of emergency, we endeavored to assist at least 1,500 families with rent payments, and we set up a crisis assistance hotline, which is now closed because we had really nearly 40,000 people that made application for the funds that were intended to serve about 1,500 families. So until we have a conversation or discussion before the Board of County Commission, we had to shut it off so that we could really process the applications that are in place. That program was intended to be a short-term, a stopgap measure for to fill the period of time between when the crisis hit and when the federal government or the state will have other dollars available to Americans and Floridians. Of course, the CARES Act was passed at the federal level, and the president signed it into law. And as a result of that, Americans who meet certain thresholds, if their individual incomes are below $75,000 and they were working, they were entitled to up to $1,200 per person. And then if they had children, dependent children, another $500 per child. And that really crosses the gamut in terms of who would qualify for those federal funds. That process is being put in place, and likely within the next 2 weeks or so, that process will be well defined. And so we will, again, our program here within Orange County was to fill the gap between the Americans being able to access any funds through the CARES program and now. We have a number of workers who have been displaced, who've been furloughed from their jobs, and so it was to help them. We also have a program where we help low-income individuals who struggle to pay their utility bills, their heating, air conditioning bills. There's an established program here within Orange County where individuals can get information, and they can fill out the application for the most part for those programs online, and then it requires the submission of certain documents to validate the true need that they have, and those programs will continue. We do have information that is posted on our websites about these two primary programs that I have mentioned at this point.
Well, thank you, Mayor, for keeping us up to date on what's going on here in Orange County, and thanks for taking time out of your schedule today.
Thank you very much. We look forward to serving our residents of Orange County. We know that if we work together, we will get through this pandemic. We have detailed plans of actions and strategies to make certain that this pandemic has the least impact on our community as possible. However, we know that we haven't seen the worst yet, so we are planning for the worst but hoping for the best during the next several weeks.
Well, thank you. We appreciate your hard work.
All right. Thank you very much.
And we'll be right back. Let's get an update from our local medical professionals as it refers to the coronavirus. And joining me is Dr. Christian Zuver, who is the Orange County EMS Medical Director, and Dr. Raul Pino, the Health Officer for the Florida Department of Health in Orange County. Thank you both for joining us. I want to start with you, Dr. Pino. What are the coronavirus numbers right now in Orange County and statewide?
So the coronavirus numbers change daily, basically by the hour. We are inching to 600 today, so we have 578. The state number just passed 9,000, and we have additional death in our county that we will inform the public later. But these are expected numbers, and we have alerting the community that this could be happening.
And Dr. Zuver, what is being done with the testing efforts? I know that there's testing efforts in different parts of Orange County.
There are. There's a federal site down at the Orange County Convention Center, and that has been testing members of the public as well as and healthcare workers. Fortunately, they have capacity issues there. Only do approximately 250 tests per day, and we're meeting the quota early on today. Additionally, the Department of Health, under Dr. Pino, has been performing tests at their site via a Department of Health process. The hospitals, of course, are testing patients and appropriate emergency department patients using national guidelines.
And Dr. Pino, one of the questions that so many people have who are a little confused about whether or not they should be wearing a mask. What is your position on whether or not everyone should wear a mask?
So that's an interesting question, and it's going to change too. I believe the government's going to come out with new guidance on mask wearing. At this level, where it's a community-wide distribution, it could make sense. And also the recent findings that the virus can travel a little bit through the air and some distance may justify for those who can have it to wear a mask, especially if you are going to gatherings what is a significant number of people.
And so when people start to feel ill, should they immediately go to a doctor right now? Is this a good time, or should they really give it some time and figure out what they should do first? And I'll take that. Dr. Zuver, you want to take that first, and then we'll get to Dr. Pino.
Sure. I think that it really depends on the type of symptoms that they're having. Individuals are having mild symptoms. The best first option is to contact their doctor and work on a plan for either a telehealth evaluation or just plan on staying home. Mild cases can be initially taken care of at home. 80% of the cases turn out to be mild and don't need hospitalization. If people are feeling worse, so chest pain, shortness of breath, concerns like that, well, then hospitals are an option for them, and the emergency departments are open and ready to take care of patients that present. The goal is to not overwhelm the healthcare facilities with patients that could otherwise be taken care of at home.
And Dr. Pino, do you recommend also for people who have access to telemedicine to maybe start that journey with their doctor using any kind of telemedicine that they might have access to?
Oh, absolutely. And we have implemented at the health department as well, and we are seeing a large number of our clients through telemedicine. And it's a great tool, not only for these circumstances, but also for life. If you don't want it or don't have the conditions to leave home and have access to those services. And I want to emphasize what Dr. Zuver said at the last part of his answering your question, is that it's important to keep ourselves away from the hospital and only go there when it's needed. Always consult your primary care doctor before going to the ER. If you are concerned about infection, if you are concerned about getting sick, the ER is not the best place to be.
And Dr. Pino, you mentioned about the testing sites. I know here at the convention center site, they've changed the rules and the age restrictions that they had. Why did that happen, and who should get tested?
So in part, I believe it was changed to increase the number of people that they were able to test. They are able to test about 250 people a day, and at some point those were getting some, it was slowing down. So opening the age range makes sense. But also the fact that it's a larger community distribution at this time may have influenced this decision.
And Dr. Zuver, if you are tested and you do get a negative result, what are the precautions you should take in order to remain that way, to remain negative?
Well, I think the precautions are exactly what we're telling all members of the community to do right now. And that is, of course, the first is social distancing. Following the stay-at-home orders and not putting yourself out in public where you can be at risk. If you can't, then distance yourself appropriately. Hand washing and hand sanitation is essential. And the full 20+ second hand wash is necessary. If you don't have soap, you can use hand sanitizer. And then covering your cloth into your arm and not into your hand. The typical things we tell people during flu season as well hold true now.
And Dr. Pino, a lot of people, because it's Florida, the weather is nice, people want to get outside. Is it more dangerous indoors or outdoors? What should we think about when we want to get out and get some exercise and some fresh air?
So social distancing, washing your hands before and after, and exercising is a good way also, and would be great to diminish the stress that people are feeling and going through. But gyms and other places that are crowded and smaller places are not recommended where you need to touch a lot of surfaces. But if you are going for a run, if you are going to a bike ride, or if you are just to walk, keep social distancing, keep the approach, but yeah, enjoy the exercise.
And I know this is pretty much uncharted territory for pretty much all the residents, and definitely probably for you as well. But are there any other thoughts that either of you wanted to leave with us and leave with the residents of Orange County about dealing with and getting through this pandemic? And I'll start with you, Dr. Zuver.
Well, I'd just like to ask the residents of Orange County to help those healthcare workers and first responders, ancillary staff, to keep them safe, and do that by staying home. That's the best thing we can do to decrease the risk of exposure and infection, and to make sure that everyone stays safe during this pandemic.
Dr. Pino?
I will just emphasize the same. We are going to be the ones that stop the transmission. There's no medicine, there is not a vaccine. Testing may decrease the relevance that it have in the few weeks, but isolating ourselves and keeping our family unit and preventing transmission from going outside, that's the only thing that we can do. And people should know that this, no more time than this one, we have to be socially responsible. The number of people that are going to die during this epidemic is going to depend on how well we execute the advice that we have given by healthcare providers.
And just one last thing, because you mentioned that it's some responsibility that we have. Dr. Pino, I understand that about 25% of those who have the virus or potentially have the virus don't have any symptoms. So how do we navigate that?
Yeah, And that could be probably why this is raining like a wildfire. Because sometimes it doesn't explain the speed on which they transmit that is only attributed to the people who are known to be positive. We have found a few, not that many, but we have found maybe 5 with our sample that has been without symptoms and carrying the virus. And those are dangerous in the sense of that you don't know, you're going around, you are spreading and you're infecting people. So that's why we have said over and over, assume that everyone has it. Assume that you have to protect from everywhere.
Absolutely. Well, Dr. Zuver, Dr. Pino, thank you for being with us and keeping us informed from the front lines of this pandemic. And we'll be back with more. There are countless organizations working to fight this virus by doing what they do best, serving the community. Joining me is Karen Broussard of Second Harvest Food Bank to share more about what they are doing to help during this coronavirus pandemic. Karen, thank you for being with us today. And what is Second Harvest doing to help those in need during these uncertain times that we're in?
Well, I mean, we're doing what we do best. We're really providing hunger relief for people who don't have enough food to eat. But in this particular landscape, which is, so unknown to all of us, we're really working hard to sort of reconfigure and rework what we do really well and adapt it to the needs of the moment, which is interesting, to say the least. It's taking a lot of time and energy and dollars to coordinate new systems and plans to get food to people without getting too close to them. Obviously, with keeping our social distance that we need to have. So it's pretty challenging to meet an unprecedented need in the community at the same time that we're trying to manage far fewer volunteers who we rely on to get food out of our warehouse, as well as how to actually get food into the hands of people without getting too close to them.
I would imagine also that those volunteers that you mentioned, keeping them safe is a very important component to what your strategy is for getting food to people. What are you doing in this age of social distance to help keep them safe as well?
Right, it's really challenging, but we put some very specific things in place. For instance, we typically have in the neighborhood of 50 to 60 volunteers in the warehouse during any 3-hour period. Right now, we're down to about 20 in groups of 10 who are all 6 feet apart, each of them. They're usually working on a conveyor type line, but now they're wearing gloves, they're wearing masks. We just had some masks donated to us the other day. But man, they're working so fast. They're getting so much done. I heard about a group of 20 volunteers earlier this week that managed to pack, I think, 4,000 boxes of food in 3 hours. So pretty amazing. I mean, very efficient. So we're very, we are taking real precautions. We have precautions posted in our lobby and on our website about conditions about one's health when they come into the warehouse to please not come in if, they've been feeling feverish, have any symptoms, or have been traveling, things like that. The same common sense everywhere.
And also, I mean, we have this statewide stay-at-home order. Can people volunteer, first of all, and are you in need of more volunteers at this moment?
Yeah, actually, we are considered an essential service. We are food, just like a grocery store. So we have distributed letters to our emergency food providers in our network of countries that will allow them to travel to the community safely, freely. Certainly, our staff can do the same thing.
I would consider the work that you and your volunteers do really being on the front lines. Is there anything that you would like to leave with the community at this time when people are so uncertain and really, and some people uncertain about or unstable about their future and their ability to feed their family? What would you say to the community at this interesting time we're in?
And it's a great question. We understand that people are really getting quite frustrated and to feed their families as more and more people are losing their jobs. I want to say, hang in there with us. We're doing everything we can to be put into the community. So please be patient with us.
Well, Karen, thank you, and thank you to Second Harvest for all you do to keep us healthy and together during these very uncertain times. Thank you.
You are very welcome.
We've heard from a variety of leaders today trying to keep you informed about the coronavirus, from local government to the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. Well, we are also here to help you keep making those healthy connections. We'll see you next time. Stay safe.